guys. Ahmad, stand up. Let me see. Yep, how tall? Marin, you're catching up to him. Michael, that's right. Get right over him. Hi, guys. How are you? Listen, I'm going over your questions and I'm like, I don't know. What are you guys looking for like a women's like are you doing like because Women's Month? I don't know.
Yeah,
I'm
so
like,
can you hear us?
yes.
All right, so originally it was in March, it was women in healthcare. But obviously we weren't able to get all that coordinated quick enough. So it's really for our March podcast. So that's why those questions are formulated the way they are. They came up with these questions.
Gotcha. Oh, hey, what? Whoa, Mr. Espinosa, bring it back. Bring it back. Look at that beard. What is that? You all let him get away with that?
Right?
Oh, Santa, scooch back over.
Yeah, no,
Come
right?
on, let's see.
He's getting old.
I hope you guys give him a bunch of junk over that. That's
That's
hilarious.
why this is like that, because of these guys.
Listen, that's fair. That's fair. I have 4 teenage daughters. I like Twitch. And I got one that's graduating. So I guess the thing is that in nursing school though, or in nursing, mainly females. You know what I mean? So I don't feel like women are underrepresented. It's actually the male that's underrepresented. The MRS. We oftentimes miss out on the MRS. The it's so it's hard for me to what did he say? What did he say, Sam? What did he say?
No, I let them know that you had the questions ahead of time, so that they understand why you're already answering. So
Yeah, why I was like, I don't know what do they want from me? And then I'm like an empowering story. I'm like, I don't have anything good, guys. I don't know. Tell me what is it that you're looking for so I can try to help.
first, I'm gonna try to turn up the audio on you so they can hear you better. So hold on.
And then we're kind of gonna do like a little podcasting format. Michael's gonna say something, and then we're just gonna like go through the questions. Like each one of us are gonna say like one question and then answer. Oh dear, that's loud.
Okay, see, I've never done a podcast before either, so there's that. Never done a podcast before. But I guess the thing is like I don't have like a big empowering like great story for nursing. I don't know. I don't know. I guess that's what I'm trying to figure out. Tell me what you're looking for, because I don't really have any great big
So
stories. The only thing I can really tell you is healthcare and education have always helped me move on in life, right? So that's basically that's all we can really talk about.
okay, so you're seeing the opposite, right? So one of the questions here you guys have
You want me to like
was,
start?
yeah, so let them they'll ask you the questions, you'll answer the best that you can, and even if, like, I think it's great that you're seeing the opposite, even though the question's about women being represented, it's okay if it's the opposite of what that question
Put
is.
some of that in there if you want. Yeah.
So,
Okay, so you're okay with me being like, you know what? Because women, we kind of like rule when it comes to nursing. I mean,
so they're gonna go one by one and ask you the questions. Right, so-
okay.
Okay. Michael, are you doing like an intro or no? She's doing are we doing an intro?
Skip the intro, don't worry about it, because we only have 40 minutes, because that's what Zoom allows with a free account. So go ahead, get into your questions.
Okay.
I feel so ill prepared. I feel like I'm being tested and I just didn't study.
Our revenge. Okay. Our first question for you is what was your inspiration to kind of enter the health field, and what was your path or steps you took when you first started?
So the reason why I entered health field, right, healthcare nursing, is because I wanted to see the difference, see the change. Like I'm a person of service, right? So I went and I was pursuing social work and counseling, and I found that a lot of times I just wasn't seeing, the work that I was doing. And I knew with nursing, I could go in, I could make somebody better, I could see it, I could see the progression, they could go home. And the steps that I took, well, the first thing I did was I went to BOCES. So I went down and I took this TABE test, and they said that I qualified, and I went to OC and BOCES in Liverpool. Eh, That was my first one. We've come a long way since then, but that was in, I'm not going to tell you the year. I'm going to keep this fair.
I feel like you say that, and then later on in this conversation, you're gonna tell it to us.
Don't worry, I'll tell them.
Now, listen, Mr. Bearded
Graduated in
fella.
like 2000s, right? You're like still like you're real young. Yeah.
I'm sorry, I can't hear you very well.
Yeah. Yeah. You're too young. You're too gorgeous. Yeah.
What'd you say?
Too gorgeous. So you're actually gorgeous. Okay, are we ready for the next one?
Yes,
Okay.
ma'am.
Being such a demanding field, how do you balance your professional and personal life?
You don't. No, so what actually nursing, I find teaching to be far more demanding and hard to balance personal and professional life. Nursing is actually very, very easy to balance. It's one of the perks of the career is the fact that you can go in and work 312s and then have 4 days off, right? Like you can make your own schedule. Oftentimes there's a lot of autonomy with that, right? You can play with your schedule a lot. So in nursing, I find that's one of the appeals is that you can make your schedule how you want it, and you can balance those times. I mean, I did it with my childcare for years. I worked night shifts, so my kids I didn't have to do childcare. I had to send them out, you know?
I was gonna say, like, how does that like balance when you have kids?
When you have kids, it worked out great. We used to call it catch the kid, right? So my husband and I worked opposite shifts. So I would drop the kids off to him, and then he would take, and I would go to work, and he would come home from work with them. So yeah, we called it playing catch the kids.
Okay, who has the next two? That's three.
Thank you, Marin.
Okay, so you should come to our graduation this year.
Yeah.
The fact that you think I'm not.
Okay, it's so lovely to hear from you again.
No, it's so nice to see you.
I'm glad. Okay, our question for you is: do you feel like you have an equal voice compared to others in your field?
Yeah, I do. I feel like nursing, especially when you work, like I worked at St. Joe's, right? So at St. Joe's, part of being magnet status was we had like that shared governance, and like we have meetings, and I feel like our voices are heard pretty well. Nursing being the forefront of healthcare, I feel like oftentimes they hear us. Doesn't mean that much, as things like staffing. I mean, we all have our issues, but for the most part, I feel like we're heard. Yeah.
Yes. Am I asking the next question before?
Salmon.
Oh, come on, Sam, let's go.
Based on your experience, how do you feel women are like being represented in your field?
Well, women are my experience, in since 2000, is mainly nursing has mainly been female dominated, right? Like it's very rare to have a male nurse around, right? Actually, they're rather coveted because when they come, it's nice to have. But oftentimes there's been a little bit of a switch, I would say, in the last 5 years since pay has started also evening out, right? Since then, you've seen a lot more men have taken to the field. Everybody's watching Fockers, right? Have you seen Meet the Fockers, Meet the Parents, right?
I think so, yeah.
Oh no, come on, Marin, you're failing me now. But a lot more the male nurses now way more accepted. It used to be that men could only be the doctors, right? And no, it's so much more. I feel like men were underrepresented in my field forever. And now I feel like they're starting to make their way in. Like right now, I have a class of 30 and only 3 are males.
Yeah,
It's good.
huge. Okay, For my next one, I have you encountered?
Oh, I can't hear you. Louder.
Okay. Have you encountered a bias or sexism within the medical field, and how have those experiences affected you positively and negatively?
Like,
Like, have you at all?
I am trying to. So, patients sometimes forget that we have degrees, right? And they forget that we are not there. We're there for more than getting them sandwiches, dietary, that kind of stuff. Sometimes I feel like that's there, but it's easy to correct. How shall I say? It's easy to redirect the patient and say, I'm here for your medical needs. I'm here to help you feel better. I'm here to get you your medications, those kinds of things, right? So I wouldn't say necessarily sexism and it won't help me advance my career or things like that sense. But sometimes patients, you know, they can be a little um sexist, right? Like thinking that you're just there, like a nurse, we've all seen, the Halloween costumes. People have certain perceptions about nursing and what they are there to do. So oftentimes we might have to redirect our patients to remind them why we are there to care for them.
Oh.
I can't hear you. Say it louder.
Can I add in like a little something?
Yeah, no, it's fine. That's part of it.
Kind of bouncing off that. How do you think like people see nursing? Do they think it as like kind of like a whatever, and they don't really appreciate it as much?
I think that waxes and wanes over the years, right? Like sometimes I think it depends on where we are in the world and what's happening. Oh my gosh, I've actually been in nursing long enough to say it depends on what's going on in the world, right? To say whether people value our opinions or don't, right? There was a time where it wasn't very valued, and then it became in society, oh, if you're a nurse, you must be very, very smart and understand that, right? You have degrees and then there's also a switch, I think now with with Google and with all these other things. Now I feel like you really have to push and understand and explain things further. It just comes with educating your patient more, I think, these days, right? Like they can look up their medications, right? And they can look and they can see things and they can be like, wait, this med says here that it is for blood pressure, but you're telling me that you're giving it for me for anxiety. I don't understand, right? So you have to be able to really meet the patient with that and be like, okay, so here's what we're going to do. Yes, this helps your blood pressure, and it is a blood pressure medication, and you see that on your phone, right? You've looked it up and you've researched it, but here is what it does, and here's how it interacts in your body, and this is what it causes, and it takes you out of your fight or flight, takes everything down, and that's why we're using it. So I don't even what were you saying? I feel like you just have to explain more, right? It's just we have to.
We got it. Yeah.
Yeah.
I should show you. If I showed you my kid right now, she'd kill me though.
Wait, do I need that?
Okay. Never mind. Okay. Did I answer that, Maren?
Yes.
Yeah.
Okay.
So I know you were saying that like you don't feel as if women are like underrepresented like in the field. If anything, you feel like they're more represented. So this question,
Absolutely.
why do you feel it is important for women to be represented in the medical field? But why do you feel it's important for women to be represented at all, like in any field?
Well, I'm a woman. So I feel like women need to be represented everywhere. I mean, fair, right? Come on, where's my snaps? I get no snaps for saying because I'm a woman. Really? All right, thank you. Well, when you talk about the healthcare field, women's healthcare is a big issue, right? Especially African American women. Let's go with that, right? They have high maternal mortality rates. Like, women are definitely. Can you shut the door, honey? You, yeah, you. Hey, you. Should I shoot something at her? Will you shut the door? Help me out. Just a little. Thank you. Okay, love you. Bye. Um, so I mean, women need to be, that's why we need to be there because those things don't happen. Research, all that stuff.
Yeah.
Did I answer that one okay?
Yeah.
Okay. Like I lost my train of thought again, guys.
Well,
Kids and dogs. Sorry about the barking.
Come on, guys, the dad's coming.
Okay.
Hello, Ahmad.
Hi.
Good to see you, sir.
Great to see you too.
Because I didn't see you at any track meets. I'm just throwing that out there real quick.
Any track meet? I don't think because our track meets are different this year.
Oh, but I saw others.
They changed it. They're doing these like mini. I don't know.
Did you run indoor?
We can talk all about it, but I think we should.
Did you run indoor? Are you running outdoor?
I'm running under right now. I'm actually after I say this question, I'm gonna say bye and I have to go. But
Oh, fine, whatever.
but could you share an empowering story that you have experienced in your career, other than that one time when you got crap on you? But you know,
I don't know what you talk of. What is it you speak of? Empowering. Explain to me what you mean by empowering. Like,
I think like, but I didn't make.
because there's.
But I think what it means is like something that you were kind of moved in when you in your career, or something that really that was like your moment when you were like, this is the career that I love.
I know what you're talking about now. You're talking about the NG tube when I told you the moment I knew I was a nurse, huh?
Yeah.
When the NG tube went down and it was yes, and oh, Ahmad, that's hilarious. All right, so empowering. Well, taking care of people is I'm not empowering, but let's talk about how it makes you feel, right? What's my draw there? There's so many stories where people have just, just that simple thank you to know like that somebody is in some of the worst moments of their lives, right? And to know that you've comforted them, you've made them feel better, you've helped them. People can't breathe, they're really scared, right?
Yeah.
Being able to help somebody through those moments leading up to whatever needs to happen to make them feel better. You can't really beat that. I wouldn't call it empowering. It's just that feeling of well, like I said, being of service, right? We all have to have purpose in life, right? What is your purpose? And it makes I wouldn't say more empowering, it's just it tells you what your purpose is, right? And I oftentimes feel like in nursing, you get that a lot. You get reminded of your sense of purpose, right? Even if there's 8,000 things to do and there's all this stuff going on, oftentimes the human aspect, the people piece of it is probably the best part. I mean, and those relationships don't stop, right? So I have a patient that I took care of. Oh, let's go by baby years. So 2010, right? So from 2010, I took care of her for a while, right? 4 or 5 years. And then her mom and I became close, and her mom and I maintained a relationship. And when she passed away, I actually went to the funeral. Fast forward 16 years later, right? So those relationships that you create in healthcare are I don't know, it's the bonding. I love that. So that's what I would say more. I mean, empowering. Oh, I wish I had some good empowering stories to tell
I
you,
mean,
but
sometimes it's just to help people, you know.
no, honestly, Ahmad, it's all about your purpose, right? When you think about it, when you get up in the morning, what's your purpose? What are you gonna do?
Yeah.
Right? Huh?
I said to get good grades.
To get good grades, right? I have no other purpose. But then once you're done, right? Your job, what you do for your life has to feel good. It has to give you purpose. It has to give you meaning, right? Has to empower you to get out of bed and get to your work. There you go. Yay! Look how you helped me take that question home. Nice job, Ahmad. I'm gonna give you snaps.
Thank you. You should also get snaps though.
Hi, Victoria.
was great talking to you, Miss Judd, but I am gonna go to practice now.
Yay, Ahmad, I hope I see you at some track meets.
I hope I see you too.
All right, take care.
Bye, Rod.
I miss Judd.
So, how are you doing?
Michael's getting a little taller, don't worry.
No,
Just a little bit.
Just a little bit. Alright, bye.
What?
maybe like a quarter inch.
Sunday?
Yes.
That's
A little less.
Sunday?
Yes.
Oh, you will.
What are the barriers for women entering and staying in the healthcare field?
Can you say it again just a little bit louder? And can you go shut the door, honey?
What are the barriers to women entering and staying in the healthcare field?
What are the
What are the barriers?
barriers? So, barriers?
Yeah.
Kids. It's always kids. No. Women oftentimes, and you know what? It is though. I mean, I'm gonna roll with it. Oftentimes, women are the ones who are responsible for taking care of the kids, and making sure that the household's running and everything is going like it should. And that makes it harder for us to further our education, further our careers, to do those things because it's just kind of the role we take, right? I personally, that's how I feel. That would be the barrier. Oh, all right.
I do have to go now too. I also have to go. So
Oh yeah, where are you going, Michael?
I have to go home.
You know what? That's fair. Bye, honey.
Bye bye. It was nice seeing you.
Bye, Michael.
Good to see you too.
Hi, Miss Judd.
Oh, hi. How are you?
Good. So last but not least, the last question. How does teaching high school students compare to teaching adults?
Oh, dear. Where do I start? I know, right? Adult education is a bit more of a challenge. I suppose I would say because adults are used to making up their own rules, right? They're the ones who are used to making up the rules. So oftentimes they find it a challenge to accept that there might be rules they have to follow. And then it's hard to also try to get them to hear you on certain things, right? Like, because they have so much life experience behind them, where I find that kids are more amiable to understand that stuff. So it's a bit different, for sure. I would say both have their pluses. I mean, look at you guys, right? Like, hello. They pluses and minuses. Where'd Mr. Espinosa go? Did he leave you guys? Was he got by?
Santa's here, but
Yeah.
I don't know what this
I just want, this is their whole thing. They've organized it.
Oh,
I wanted to be out of the video.
well,
They're just-
Victoria didn't ask me a question.
Victoria, you have a question?
Hey there, Finn. Finn's up.
So
Come closer.
versus okay, I guess I'm getting up there.
Oh yeah, I'm putting you on the spot, Miss Lemoyne. Let's go.
oh, you saw it.
You know I did. Congratulations. Very excited.
Yes, I heard your child's going there. So women versus male, in the field, what do you think? Do you think there's disadvantages to being a woman in healthcare? Do you think male have an upper hand?
Men have I'm deaf, or you guys are just talking real loud, low.
Priority over women in healthcare? Or is it kind of the opposite?
I really don't. Yeah, and nursing. I'm going to speak on nursing only because nursing is, right, that's where my experience lies. I feel like it's mainly, but if you stop and you think, when you think of a nurse, what do you picture?
A lady.
Right? So unfortunately, I feel like men have to work harder, right? Men have to work harder to prove and harder to get in. Right. And most of the time when you see a male nurse, the question is, well, why aren't you going to be a doctor? Right. They always seem to ask that, or how are you moving on with your education? Where with females, they're not asking that question.
So do you feel
So-
that its progression, with like thinking of that specific question, when they see a man, they automatically assume, hey, why aren't you a doctor? Do you think that kind of like puts that barrier up for like not motivating like nurses or females to move up in the track?
No, oh my gosh. Have you ever seen a room full of female nurses? I've never seen anything more competitive in my life. Let's talk, right? You get a group of female nursing students and woo, they are competitive. So, um, I don't know if that would be a barrier to that one.
No, but I mean, it's just, to hear it from you, hear it being said that way, it's almost like the expectation is that you're gonna remain the nurse forever.
Yeah.
Right,
like,
so that's kind of why
I see what you're saying. Yes, because nursing has so many different levels, right? So nurses oftentimes will be moving up in the nursing realm, but very rare do we move on to the doctor level. And I don't know. I guess maybe it's because I mean, because we're just so smart. If we wanted to be doctors, we would, right? I don't know. But in nursing, what we do to each other a lot of, and what nurses, we advance. I mean, just like I did, right? We go from CNA, LPN, RN, BSN, right? And then we go to our NP. We move and we move. The beauty of nursing is never is always changing, always evolving. You don't have to stay anywhere in any one spot, right? And you're always learning and you're always growing. So but yeah, I see what you're saying. Like I get it. With guys, they do look and they're like, oh, why aren't you going to be a doctor? Right. But yeah, with females, I guess they don't. Maybe that assumption's there. I don't know. That's good food for thought, Mr. Espinosa. I'm gonna take that and digest on that, and I'm gonna get back to you. I'm gonna put it in the parking lot.
sounds good.
You know what, Emma? You haven't asked me one thing, did you? Get up here. Why is Emma not talking to me?
No, I am. No, I no.
No.
No, I don't have any questions.
This is surprising because she runs one of our so we have a couple of our podcasting team members from the grant, and Emma is the one that is one of our hosts. Ricard's another host, and usually Emma's asking a lot of great questions. You don't have one today? Come on.
Emma, come here. Get up. Let me look at you. Hi, honey. Get over here.
You should see her hair. She cut her hair.
You cut your hair. Let me see.
Oh,
Oh my God, let me see. Oh, it's adorable. I love the braids too. Oh, Miss Emma. How are you? Shy? Since when? Since when?
yeah, since when? You're right. You're right. I'm sorry. I do apologize for that behavior.
Come on. What you got for me? Ask me anything.
Well, maybe not anything.
You can ask me anything.
I know. So how do you think you compare yourself? Like, what is your growth that you've had since, like, I'm not talking about like childhood birth. I'm like growth. Like, I'm talking about like, how do you see yourself growing through your academics? Like, we heard the stories of you doing prison work, being a nurse, dealing with a bunch of rude patients, to now a bunch of cool kids, to now growing. Like, you've had growth. How do you feel like you've gained that growth? How do you, as like mentally, how did you prepare yourself? How do you feel as you've given that growth?
As I've what? As I've had that growth?
Oh, yeah, 10 minutes.
Meeting will end in 10 minutes.
Oh, quick. Okay. What do you mean? How do
you feel like you've given that growth as like your jobs have progressed?
how do I feel like I've given that growth?
Like, how, like, given like,
How did you grow?
like how do you
How have I grown?
Yeah.
Oh, Miss Emma. I feel like I love it. I learned something from everybody, right? Every different job I've been in, I've learned something else, something new. I got to be honest, I'd be bored in the same job for too long, right? And those whole kids, as you like to call them, are some of my favorites. I learned so much from you guys. I learned how to do interactive classes, right? How to let you guys lead and do the work, right? The growth And then I've taken that and I've thrown that over into my classroom. And come on, we all know I'm looking to go back to school again because that's just what I do, right? I'm most likely start taking classes again in the fall because I don't know, I'm crazy. I don't know. But I think that's part of people who get into healthcare or people the appeal to healthcare, right, Emma, is the fact that it always changes. Everything changes. Nothing stays the same, right? And you get to grow with that. And sometimes growing pains hurt, right? But all the time, it's always good. It's always good because you always get something better out of it in the end, right? Perspective. So,
Like with like, okay, so now that you said it, like, is there any regrets that you feel like you've made along the way or anything you would have changed?
in what?
Like in anything, like as you move forward from job, from like this, from like different like aspects of different jobs and different like learning experiences, did you have anything that you regretted about doing them or anything you regretted learning or any mistakes that you regret were making?
I'm not a fan of regretting anything. I'm a fan of growing, learning, right? I don't regret anything. It's just like mistakes. What are mistakes? What are they? They're just chances to learn, chances to grow, right? So I don't do that backwards stuff. No way. You know what I do regret? I regret that I didn't give you a big old hug and I can't come through here and give you a big old hug. That's a regret. But as right? But your mistakes are just reasons to grow, right? They're just chances to grow and chances to learn. What's up, Miss Victoria?
You said graduation. Mine is first.
I know. Oh, wait, I know it's coming. Guys, did that answer your questions?
Yes, it does. And
Yes.
it also is a really good wrap up to like how we wanted the overall like theme of today's episode.
Yeah.
I'm glad because I love you guys. I love seeing you and I love talking to you. And women in healthcare, I feel like yes, nurses, we are very, female, we're very well represented. But in female healthcare, right, our actual healthcare, highly underrepresented. We could have done a whole other podcast on that one. Oh,
Maybe
Ellie's home. You got her. Shh. I can't hear you. What are we doing?
Maybe we'll have to have you come back.
What?
We might have to have you come back. Come again.
Oh, come on. You've never lost me, and I'm right here. You have me anytime you want me.
So just so you know, it might end soon, so we might get cut off. So if that happens, it's because the time limit is reached on the Zoom free membership.
Oh, I know. Well, I got this one home. Ellie, you want to sneak in and say hi real quick? Come here. Eliza's at track practice. Come say hi to Ellie. No, you gotta scooch in. Look, they can't see you. Scooch. Hi. There's Eliana. All right. It was really great seeing you guys. And anytime you have any questions, anything you need, you let me know, okay? All right. Bye, guys.
You did amazing. You were nervous about it, but you did amazing. So
So nervous.
Tell her about Mr. Minnow.
Oh, yeah.
That's another time.
It's another story.
I can't leave. I'm here forever.
Ah.
Let me leave. Bye. You're gonna have to sign out.